Hello everyone and welcome to the Star Health Insurance YouTube channel. I'm Dr. Shailesh, MP, consultant neurosurgeon, and today we are diving into a condition that's often called a silent thief or a silent disease, that is osteoporosis. Did you know that it can weaken your bones so much that even a simple sneeze could lead to a fracture? And when it affects your spine, the impact goes far beyond just the back pain. It can change your posture, mobility, and affect your quality of life. So let's break down what osteoporosis does to your spine and why it is so important to stay ahead of it. What is osteoporosis? Osteoporosis is a progressive bone disease where bone density and strength decreases over time, making the bones more fragile. The condition is often referred to as a silent disease because it progresses without symptoms until a major fracture occurs. The incidence of osteoporotic spine fractures is increasing day by day globally as well as in Indian population, especially in regions with high life expectancy, and increasing awareness of osteoporosis is very important, especially post-menopausal women. Due to the hormonal changes, drop in estrogen levels, their bone density gets affected, bones become weaker. Osteoporosis and the spine. Spine is one of the most commonly affected areas in individuals with osteoporosis because it is made up of multiple small interconnected bones, also known as the vertebra. These are subjected to continuous stress and weight-bearing activities. And osteoporosis weakens these bones, they become more susceptible to injury. So how common is osteoporosis? Osteoporotic spine fractures are estimated to affect about 1 in 3 women and 1 in 5 men over the age of 50 years during their lifetime. Worldwide, osteoporosis is responsible for approximately whopping 8.9 million fractures annually, which equals about 1 fracture every third second. These fractures are often the first clinical manifestation of osteoporosis. So how does osteoporosis affect your spine? Osteoporotic spine fractures, also known as the vertebral compression fractures, are one of the most common types of fractures associated with osteoporosis. They can result in a severe debilitating pain, restrict ambulation, making the affected individuals chronically bedridden, loses height, postural changes such as kyphosis, a change in curvature where the patient becomes hunchbacked. Sometimes the fractured piece of bone can sit upon the spinal cord or the nerve roots, causing neurological deficits, limit walking, loss of sensation, loss of control of bladder, and bowel activity can happen. The most common spinal problem related to osteoporosis is a compression fracture. The fracture occurs when the vertebra becomes weak and collapse under the pressure. A small amount of pressure such as bending, lifting, traveling on bumpy roads or simple slip and fall can cause the vertebra to collapse. Over time, the fractured vertebra can cause the spine to lose its height, leading to a stooped posture or the so-called kyphosis or the hunchback. Spinal fractures can cause severe pain, particularly if multiple fractures affect multiple vertebrae. The pain can become chronic and may limit mobility. Typically, these pain become worse during the night and doesn't relieve even upon rest. Multiple compression fractures can lead to spinal deformities like kyphosis or exaggerated lordosis, which is exaggerated inward curvature. These deformities can lead to difficulty in standing upright and walking. So what are the various risk factors for one to develop an osteoporotic spine fracture? Age. The risk increases with age, particularly after 50 years, especially so in postmenopausal women, where there is a drop in estrogen levels. It plays an important role in maintaining the bone density. A drop in estrogen can lead to severe osteoporosis. A family history of osteoporosis or fractures can increase your risk as well. Lack or deficiency of calcium and vitamin D, which are essential elements to maintain the bone health, can lead to osteoporosis. Lack of physical activity, particularly weight-bearing exercises, weakens bones and muscles, making them more susceptible to development of osteoporosis. Excessive alcohol consumption, smoking, can impair bone health by affecting the body's ability to absorb the nutrients needed for bone strength. Medical conditions such as hyperthyroidism, rheumatoid arthritis, and certain medications such as steroids can increase the risk of developing osteoporosis. So what are the common symptoms of osteoporosis in spine? Back pain due to a compression fracture. This pain may worsen with movement, walking, standing, or bending. People with osteoporosis often experience a gradual reduction in the height as the vertebra compress and collapse. A hunched back or a rounded back, the so-called kyphosis, can develop due to the collapse of the vertebra, leading to postural changes. In severe cases, spinal fractures can disable a patient, limit his mobility, and making certain movements such as bending and lifting becomes almost impossible. So, how do we diagnose osteoporosis in the spine? The most commonly performed test is the bone density test, the most common test to diagnose osteoporosis. It uses dual energy X-rays, which can detect the bone mineral density in the spine, hip, and other areas. Simple X-rays may be used to detect fractures or deformities in the spine caused due to osteoporosis. Advanced imaging like CT or MRI in cases of severe pain or suspected fracture may be used to assess the condition of the spine and the surrounding tissue. So, what are the available treatment options for osteoporosis related spine issue? The treatment for osteoporosis and its impact on spine focuses on reducing the pain, preventing further bone loss, improving the mobility, and some common approaches include medications such as bisphosphonates, selective estrogen receptor modulators, teriparatide, or denosumab like medication. Exercise is crucial in strengthening the muscles around the spine and improving the posture. Weight-bearing exercise like walking and resistance training help maintain bone density. Posture correction exercises can help reduce the risk of kyphosis and also alleviate your pain. Braces may be used and recommended for spinal fractures to provide stability and reduce pain during recovery. Pain management is important, where we can use over-the-counter medications such as paracetamol or ibuprofen to help manage pain. Steroid injections are rarely used in cases of severe pain caused by spinal fractures. In cases of severe deformity or persistent pain, surgery may be the only option. Surgical options include kyphoplasty or vertebroplasty, and finally, if both doesn't work, may require a spinal fusion. Kyphoplasty is a novel technique where we introduce needles into the vertebral bodies and inject cement so as to strengthen them. Vertebroplasty is a technique where we do it without a balloon. These two are novel techniques used as a very effective pain-killing mechanism in patients who are not fit for major surgeries. So that is all about osteoporosis of spine. I hope this video was insightful for you. Do hit the like button if you like the content, comment with your questions, and subscribe to Star Health Insurance channel for more such content.